Well, let's talk about two measures of this virus that I'd like you to put in context for laymen. One is the lethality rate, as I mentioned, this 2% lethality rate, which is being spun very hard by people on both sides of the question of whether or not people should be increasingly concerned. Then there's also the transmission rate and how many people, did I describe that accurately? How many people an infected person can be expected to infect? Describe the transmission rate for this virus, how important that is to us understanding its spread and what that means we should sort of be aiming for in terms of containment.
Yeah, so the modeling that's been done so far on the basic reproductive number or the transmission rate, how many people are going to get infected from every infected person, has it kind of pegged somewhere in the 2 to 3 range right now. That's all based on the data that really we've gotten out of China.
Each infected person can be expected to infect 2 to 3 others.
Right. And so that's going to create an epidemic that grows, right? It's not going to shut itself down. More people have become infected than from each infected person than in each successive generation of infection. So that's based on the data that's come out of China at this point. And, like a number of the things you've listed here as questions and concerns, we have questions and concerns about just how accurate that data has been coming out of China. And so are those predictions and projections correct? Are they based on good data?
Is there any indication that as the virus spreads, as an index patient gives it to 2 to 3 other people, and then each of those people gives it to 2 to 3 other people, that it becomes less transmissible, that it becomes less dangerous, that the virus weakens at all as it spread?
No, there's no evidence whatsoever at this point that the virus is changing in successive cases or generations of infection. We're not seeing that in terms of like the sequence analysis of isolates that we get from people that get it in chains of transmission. There will be some accumulation of mutation that happens over time, but it's not adapting that quickly, and so we haven't seen a change in its transmissive rate yet.
So if that transmission rate holds, and you say it's important to ask questions about how we arrived at that expectation and how that will work in other parts of the world, that would imply that it's going to get bigger and bigger and bigger and bigger, and it's not going to become less lethal as it spreads.
Yeah, so the lethality is a separate issue, really, that I think we need to really kind of like try and wrap our heads around. And again, that's based on this data we've gotten out of China, and it is being spun 2 different ways. One is like, oh, it's only 2%, and the other is like, wow, that's 2%. And when you talk about highly transmissive infection like this, and you look at it in terms of, the global population, all of us are naive to this virus. There's no immunity out there to slow it down. There's no vaccine that's going to slow it down. So with everyone being susceptible to infection, there's quite a pool of people here that could potentially become infected with this thing.
7 billion people.
And so 2% of 7 billion people is a big number. And even if it's not 7 billion, but it's many hundreds of millions, that's still a big number. So again, that case fatality rate number is based on the data we've gotten from Hubei and Wuhan and the Chinese outbreak experience. And we just don't know yet if that's going to hold up as we start to see new countries experience this virus for themselves. And so if that holds, I think that'll be a devastating number to have to deal with. I hope, and I think a lot of other people are hoping, that we haven't really looked at all of the cases that occurred in that outbreak zone. And so the number of deaths versus a more realistic number of exposures and cases that occurred will bring that number down. Yeah. But right now, that's hopes.
And anybody telling you that 2% is a good number,
I can't get behind that, no. Yeah.